Okay, for this video, I'm going to talk about burns, and as an ALS paramedic, what the actual what's going through your head when you walk into these patients that have been burnt. So first of all, what I'm going to talk about is quickly. I'm going to talk about the different types of burns, the zones of burns, different zones. Sorry, the different types of classifications, your systemic response, and then your assessment as a paramedic, and then the next video I'll talk about the management. So just quickly, the different types of burns you can have, and you can't get any more than these four. You've got radiation, you've got electrical, you've got chemical, and you've got thermal. They're the four different types of burns you can get. So when you're called to a patient that said that he's burned himself, you're thinking, okay, what type of burn is it? Did he put a fork inside a socket, and did he get an electrical burn, or is he just extremely sunburnt, which is thermal? You've got, did he pull a bloody pan of water on him or something like that? So they're the kind of thing that's going through your head as as a paramedic going to these scenes, what's going on. So they're the different types of burns you get. Then you've got your different burn zones. Now you've got three different types of burn zones you can get of those four. You've got hyperenemia, you've got status, and then you've got coagulation. So they're the three different types of burn zones on the actual burn site. So hyperenemia, it's the outermost zone. So you have tissue perfusion, and you most likely recover. So you think about a sunburn, it's the outermost zone. You get your after a big day in the sun drinking or whatever, you've got this massive sunburn. It's the outermost zone. You can't get any more outer zone than above the epidermis. You've got tissue perfusion because your systemic response hasn't really taken off in its full flight. And yeah, you will recover, and then you've got the potential of getting infected, but other than that, you're pretty much all set. Then you've got your different type of zone. You've got another one, you've got a status. Now this is when your tissue perfusion starts to decrease. So you can potentially salvage these burns. So if you've got someone who's burnt their entire hand up their radius and everything, you've got tissue perfusion, and like I said, you can salvage it. The aim of this type of burn, what you want to do is you want to give them fluid, so you can increase the level of fluid going around your body, and get the vital liquid to those tissues so they don't die off. That prevents irreversible damage. And then you've got your coagulation. This is where you're completely fucked. This is maximum damage, and it's irreversible tissue loss. And this is due to not due to constituent proteins. They're all gone. So there's nothing. You're fucked. Sadly. So then we've got that's the burn zones, and then you've got, now you want to classify the burn. Is it a first degree, second degree, third degree, or fourth degree burn? You can't get fifth degree burn. It's just, I suppose if you'd been thrown in a bonfire, then maybe. Your first degree burn, you've got your superficial. It's superficial. Now this is above the basal layer of your epidermis. So if you think about your anatomy of the skin, you've got your epidermis, and then you've got all this other crap, and then you've got your dermis. So it's above the basal layer of the epidermis, and you can potentially get necrosis into the top third, 1/3 of the epidermis. So that's the first degree burn. So like I said, the sunburn, it's a bit of hyponemia, and it's a bit of first degree burn if you think about it. But unless it's really bad, it's the first degree burn. Then you've got your second degree burn. Now this is partial burns, considering in the scale of first degree to fourth degree burn, it's partial. Now these burns are the most painful, without a doubt. They're the most painful. It's damage into the dermis. So you got your epidermis, so it's burnt the epidermis, and now it's burning into the dermis. Now these fucking hurt a lot because you've got sensory receptors in there. And if you've burned a lot of you didn't burn them completely off, there's still some there, and they can feel it, and it's gonna fucking hurt. Yeah, so it's another point to add. It's necrosis into most of the layers of the skin. So that's why it's most painful, because of the sensory receptors and thermal receptors and such inside your skin. They've been partially cut straight off, so it's just unbearable. So if you go to a patient like that, just give them morphine. Don't fuck around with intranasal fentanyl. Just give them morphine because they need it. Obviously, don't stick the cannula in the bloody burn arm because I've seen someone do that before in class. Then you've got your full thickness burns. Now, these don't hurt as much as the second degree burns, believe it or not, because you've totally just gotten rid of all those sensory receptors. And the receptors in your skin, you've totally got rid of them. So your third degree burn, it's the entire thickness of the skin which is damaged. It can be any colour, and there's no visible dermis whatsoever. So you've got rid of the epidermis, you've got rid of the dermis, and it's just those top two, well, I just said, are just gone. Obviously, there's different more layers in the skin, and I'm a bad student. I'm a bad student because I haven't remembered my anatomy of the skin, so that's going to become awkward on Tuesday. And then you've got your fourth degree burn, and this is just burning to the muscle, tendon, and bone. So this is someone who's potentially like been thrown in a bonfire and their legs are just, you can see everything. You can see nothing if you think about the, yes. Now you've got your systemic response. Now above 30% of total body surface area, and I'll go into how you figure out what percentage of burns they actually have. Cytokines are released and other inflammatory mediators. So above 30%, you're going to get this systemic response of that happening. And then you can branch off into different categories of your systemic response after you've been burnt. You've got your cardiovascular system, your respiratory system, your metabolic system, and then your immune system. Hang on. So your cardiovascular system, you've got increase in permeability. So fluid and intravascular proteins, they're lost into the interstitial space. So it's your body of just trying to get this fluid into the areas that it's needed. You've got your decrease in myocardial contractility. So this leads to, if you think about that, your heart rate's slowing down. So your patient's going into shock. So it's generally bradycardia. Bradycardic patients of, go away. And then you've got fluid loss at the burn site. So you're going to see oozing of just liquid just coming out of the burns in the back of the hand, you know, for example. For your respiratory functions, you've got bronchoconstriction and then ARDS. Now, with bronchoconstriction, you can tell why this is happening because they're just trying to, everything's just condensing. It's just the sympathetic nervous system is just, I don't know the patho behind it because I haven't done enough study. And then your metabolic functions, you've got basal metabolic rate increases to 3 times that of normal. And then your immune system, you've got your general immune response, which is just branched off. But as far as the paramedic student needs to know, I think that'll do. But obviously, that's the general gist of what's going on. But you've obviously just branches down into everything minute that you need to know. Just so much detail you need to know. Yeah, so then you got your burn assessment. So you're thinking, what's the classification? And I've just gone over the classification. If we do remember the classification of the burn, your first, second, third, and fourth degree. So generally, you're thinking, what is the classification of this? What type of burn it is? And then everything that I've just gone over about under the different classifications, what classifies that as that? You're looking on the patient to see, okay, do they have? Can I see the dermis? Can I see bone? And then from there you can justify what burn, what kind of burn it is. And then you've got adults. So you've got the rule of 9, and then you got the London router for pediatrics. So the rules of 9, you've got your body's divided up into percentages. So, for example, this part here is 9%. The superficial side of your arms is 4.5. So 4.5, 4.5, and then on the back 4.5, 4.5. So each arm's 9%. Same with your legs. Your groinal area is 1%, and I think your front of your face is 4.5, and the back of the head is 4.5. So it all adds up to 9. So if I've got full burns from all over here, down one arm in the front of my face, that's 4.5, 4.5, and 9. So 9 nines are 18. And then you've got your London Brown one, but I'll go into that on a different video. But yeah, you've got so for specific examples. For example, you've got your electric burns, which I was talking about. You want to look for entry and exit points. Does the damage progress? You might get some cardiac rhythm, so obviously you want to have a look on the ECG and see what kind of things are going on. You might get some PVCs because a person might be presenting with, you know, he's quite anxious and he's working himself up, so he might get some PVCs. So and generally, obviously, if the patient is got cardiac rhythms, you'd want to monitor them just a little bit more than normal there. Furthermore, you've got your chemical burns, so you want to brush the powder off. So if you've got some powder, get rid of it. You want to now initiate prolonged irrigation, just tap water. Don't give them an antidote because it's going to delay the transport, because the thing with the ambulance is we want to get the patients, yes, we want to stabilise them, but we want to also, it's stabilise them and get to the hospital. You got to find the fine line of, do I fuck around and stabilise them and then takes longer to get to the hospital, or prioritise on road to the hospital and make the entire time frame condense. So yeah, and then pretty much that's that.